The profession of a nurse or carer is one of the most demanding and hazardous with regard to occupational accidents. More than half of carers suffer from disorders of the motor system, which are caused particularly by having to handle a heavy human body or hospital equipment. An important aid to the care of an immobile patient is the new adjustable Latera bed from the company Linet. The Latera significantly facilitates the handling of a person on the bed, significantly reduces the use of force, and is less time-consuming for performing individual procedures. The Latera bed is equipped with a mattress platform lateral tilt to an angle of 15 degrees. It is with the aid of this tilt that even a very heavy patient can be turned on his side with the minimum use of force. The patient is stabilized in this position and remains in it throughout the time that the nurse needs to perform what is required, such as the hygiene of the patient, changing the bed, or treating the patient. Only one nurse is needed to handle the patient and applies 10 times less force than when working on a bed without lateral tilt. Two nurses are needed to handle an immobile patient on a standard bed. While one nurse changes the bed sheet or pad, the other nurse holds the patient on his side. Moreover, when handling the patient, the nurse has to bend over, which, when repeated in the long term, results in permanent damage to the motor apparatus. The nurse has to apply a force of 10 to 15 kilograms to turn the patient on his side. We can use the lateral tilt for other standard nursing activities too. For example, while the transfer of a patient from a standard bed to a stretcher is a physically demanding procedure requiring at least two nurses, only one nurse is required to perform the same procedure on a Latera. The bed tilt can even be used for easier transfer to a chair, particularly for paraplegic patients. The lateral tilt comes with a bed lift and can also ease work when the patient needs to leave the bed. The Latera bed may be mostly used for the care of totally immobile persons in acute healthcare, long-term nursing home care, or home care. Procedures such as bed making, changing the patient, back treatment, massage, treatment of pressure sores, or hygiene can be performed independently and virtually without any effort. Linet's Latera bed not only saves the time required for handling the patient, but also the nurse's motor apparatus. It is also significantly more pleasant for the patient to be handled. The Latera bed, with its modern 3-column construction, positioning and adjustment of the mattress platform height, comes in two versions: the Latera Acute for acute care and the Latera Care for nursing homes and home care. The beds can be additionally equipped with a wide range of accessories such as foot controls for the tilt and the bed lift, a satellite control, nurse's supervisory control, lifting pole, drainage bottle holders, a fifth caster, and so on. The Latera is suitable everywhere where temporary and long-term care is provided for bedridden patients and clients. The Latera makes being confined to a bed more pleasant and significantly reduces the exertion required to perform various procedures when handling a patient. In comparison with a standard bed, the force required for handling a patient on a Latera bed is 10 times less. The energy exerted is a third less, and the time required to change the bed is reduced by 20%. Save your motor apparatus and your time, and let technology work for you. The Latera bed from the company Linet is a solution for various immobile persons, ranging from quadriplegics to patients in acute care. The Latera bed will transform heavy, physically demanding work into an activity that even a child can perform.